one more minute, okay? I don't know. Apparently she didn't want to like have to scan the entire room. We really have to do something about our 50-minute hours. Started now. So thank you very much for coming today. I'm going to just introduce our speaker. This is the Illuminate speaker series with the College of Rehabilitation Sciences. So thank you and welcome to this presentation. Our speaker today is Katie Dyck. And Katie's a physiotherapy graduate from the University of Manitoba with over 16 years of experience in private practice. In 2009, she started using an electronic medical record in her practice and immediately saw the benefits of using digital health tools to improve efficiency, quality of care, and patient outcomes. For the last 8 years, Katie has been working in digital health and clinical informatics in the Primary Care Information Systems Office at Digital Health, Shared Health, formerly Manitoba ehealth. She supports primary care practices with the adoption, implementation, and optimization of digital health tools, and she plays a lead role in the certification of primary care electronic medical records in Manitoba. Katie is currently completing her master's degree under the supervision of myself, Barbara Shea, and her research involves generating a digital health profile in Manitoba physiotherapists to identify variables that may influence the adoption of digital health tools. The profile will then be used in the development of a digital health core competency framework focused on improving digital health literacy. The long-term goal of her work is to better enable physiotherapists in Manitoba to adopt, implement, and optimize the use of digital health in clinical practice to enhance patient care and support advocacy for physiotherapy services. So I'll leave it to you, Katie.
Thank you for the warm welcome, and thank you to Dean Urbanowski for inviting me to speak today. It's a pleasure to be here, and I hope that everyone takes away some valuable information from today's session. So I was actually going to start with my metadata, since we're talking about digital health today, talk a little bit about me, but Barb just gave me that wonderful introduction, so I actually made a little data cloud with that information, so I'm going to just skip over that. Since Barb already spoke to you about why I'm here today and some of the things that I'm doing in terms of my graduate work. So I don't have any conflicts of interest to declare. We're talking about medical applications today. I don't have any relationships with these vendors. I'm not part of the development process for any of these apps. The information was part of one of my graduate courses, and this was from a paper that I wrote. And when I wrote the paper, one of my criteria was that I wasn't an avid user of the app, so that there was no sort of subjective bias. I have since started using one of the apps, so I'll let you know a little bit about that once I get to that point. So today I wanted to talk to you a little bit about the difference in terminology between eHealth and mHealth. There's lots of different terminologies out there in the digital health space, and just to sort of confirm, today we're talking about mHealth or mobile health, more on the application side of things versus sort of big enterprise systems. I'm going to provide an overview of mHealth, sort of give you some context and background of sort of current state and what's happening in the healthcare environment right now. Then I'm going to introduce you to the 5 apps that I've chosen to discuss with you today. In no way am I saying they're the top 5 apps and the best apps out there. That's for you to decide, but I'll talk to you a little bit about why I chose them and how I chose them and the criteria behind that so that you have a better understanding. And then I'm going to finish by talking about a new tool that's come out recently to help evaluate the quality of applications. So we all know sort of in the digital health space or when you're looking at any kind of reference material that the quality, the validity, the reliability of tools is really important. So I'm going to talk to you a little bit about an instrument that you could use to evaluate whether a tool is of high quality, whether an application is of high quality. So I think it's no surprise to everybody in the room that there's a really rapid advancement in technology, particularly in the area of medicine. Denson did a really interesting paper in 2011 and noted that the time it takes for medical knowledge to double in 1950 was 50 years. In 2010, it had moved to 3.5 years. And does anyone want to take a guess at the prediction for 2020? 6 months, I hear. 73 days. So think about the information that you know now as a health professional, and in 73 days, it's going to double. So a huge amount of information is out there, which creates benefits and challenges, of course. So we have this wealth of information at our fingertips, most certainly, but do we have the digital health literacy as health professionals to understand and use that data in a clinically meaningful way? And digital health literacy is sort of an emerging term out in the literature now, and it's really about preparing new graduates to practice in technology-enabled environments, which are the norm now, and about the foundational skills required by learners and the health professionals as they search for and use online health information and clinical systems, both in their learning and in their clinical practice. So digital health literacy is a term that you'll see in the literature now. So I'd be remiss if I didn't talk a little bit about terminology. The first column is sort of many of the terms that you'll see nowadays to describe eHealth. So clinical informatics, bioinformatics, digital health. There's no consensus in the literature about what term to use, which becomes really challenging when you're a graduate student like me, doing literature reviews, et cetera. There's just so many terms that you need to look for to gather the information. And this is not an exhaustive list by any means. The second column are terms for the applications, the clinical systems. And you can see there's just as much variety there. So it becomes really challenging from a research perspective to really understand, are we talking about the same thing? Are we comparing apples to apples? Are we looking at different things? So apps have been around for quite some time, and there's a lot of new research coming out about the benefits of using health apps. And there's a term now in the literature that, again, is emerging, and it's the term mhealth. And there's really been a lot of work to make this the term that's going to be used in research moving forward. And a lot of that work was actually led by Elizabeth Barecki, who's a nurse and PhD a professor at the Department of Clinical Informatics at the University of Victoria. And they would have sort of like the top informatics program in Canada. And she's done a lot of work in nursing standards, and particularly around digital health, but is now sort of doing some work on the medical health application side. And she really talks about it as learning and teaching interactions that use mobile handheld devices, such as electronic notebooks, tablets, or smartphones. So less about the boxed app itself, but more about the activities that revolve around using that app, particularly from a clinical perspective. So what is mHealth? I shared an article here from JAMA, and Epen and Peterson are physicians from the University of Iowa, and they define mhealth as the collection, storage, and transmission of real-time data for a variety of different health activities. And so everything from patient care, research, looking at practice reflection, continuous quality improvement, educating learners and educating health professionals, and of course the whole benefit of being able to analyze and trend data. You hear the term big data all the time. And then a real burgeoning part of the use of mhealth is health, wellness, prevention, and behavior modification. So things like Fitbits and wearables, that's an area that's just booming right now. And there is a lot of research coming out about those particular types of applications, but they caution that few applications have undergone rigorous study, and those that have lacked a randomized comparator. So when we're looking at research, we don't always have the robust research. Maybe we're seeing associations and correlations, but can we truly say cause and effect from the use of these health applications? So this is definitely an area that's been improving a lot in the last few years. And there's a lot more randomized controlled trials that are happening with the use of mhealth, which is really wonderful. So one great place to get information about mhealth is this, the mhealth App Developer Economics Survey. And I'd really, if you're interested in this area, I'd encourage you to take a look. It's by Research to Guidance, which is a global research program in Berlin. And they look at current state and future trends, and they've been running this huge annual survey since 2010. So they have 7 million data points and over 15,000 different digital businesses participating, and 60% of them are from within the health industry. So it's a really good measure of what's happening in the healthcare system. And they gather data from North America, South America, Europe, a little bit from in Asia, and a little bit from in Africa. So some pretty good scope there. And they look at a lot of different things. So from the number of downloads an app has to the different platforms that it might be using, how they're marketing the application. So they look at lots of different things and publish a big report every year. So this is from their 2018 report. And their sort of title for this is today's app is more than an app. And so it's showing sort of that app in the center of this complex, connected ecosystem, with the app really being the focal point. So you see wearables and tracking devices connected. You see connections to medical devices, so things like electronic blood pressure cuffs, electronic scales. There's more connections to electronic health records, which as a provider using systems, I can't speak to the importance of this enough. Any kind of break in clinical workflow when you're using digital systems becomes a real barrier. And so having systems that are connected and speak to each other is really important to avoid sort of having to sign into a separate system to do work and then go back to another system. Aggregated health data, so the ability to leverage data from inside these apps and look at them from a big data perspective and do trending, and then be able to identify maybe vulnerable populations or certain types of care that may need provided. And then they have this block called tools. And this is a relatively new area for 2017, 2018, and they sort of, it contains what they call social networking. So things like communities of practice, patient support groups, blogs and forums that are attached to the app. And they're actually showing that 81% of publishers using these tools get 4 times more downloads of their applications. So people using the apps want these tools, want the social networking piece. 50% of publishers are using APIs, which is an application programming interface, and it's really just a way to help different systems communicate with each other. So I kind of like to think of it as a plug from one system into another system, and that transfers the information across. It's simplifying things incredibly, but just so that you know that it's basically sort of a communication channel. Almost 50% of publishers are integrating with electronic health records, which again, I love to hear, and this is happening more and more because clinicians are putting a lot of pressure on app developers to make this seamless workflow. 42% of apps are connected to sensors and wearables. I don't think that's surprising to many of us who have been hearing a lot about wearable devices currently. In fact, they say that sensors built into devices will be the most relevant category in the next 5 years. And if anyone was here for the March Illuminate with Dr. Nestor Perez-Mayada, he spoke to some of these devices that are being used from a rehab perspective, and also mentioned that this is the next big thing. So it's something we need to start paying attention to. So why do we want to use mHealth? So what are some of the uses and benefits? And Ventola is a physician, not a physician, he does a lot of medical education research in the States. And he basically did a scoping review in 2014 to look at identifying uses and benefits of mHealth. And so this is his use of, his list of uses. And I mean, a lot of them kind of make sense, right? We talk about the efficiencies, having better time management and better control and coordination of your information. It can help improve communication, so being able to either talk within a system, talk provider to patient, talk provider to provider. So secure messaging is something that's another big thing that's, that a lot of clinicians want right now, along with video conferencing and e-visits. A use for reference and information gathering. So instead of looking in journals and medical textbooks, that you're gathering all that information maybe from an application on your phone. And so you have that information right at the point of care. There's uses for patient management and monitoring. So particularly remote patient monitoring. There's a lot of projects happening now where people we're getting people out of hospital sooner or out of facility sooner, and they can manage some of their healthcare at home. And there's a lot of apps and clinical tools that we can use on the digital health side to help support monitoring them from outside of a clinical environment. I mentioned clinical decision making. Lots of apps have great access to algorithms and practice guidelines. Some of them will actually, walk you through an algorithm based on the information that you put into the app. So again, information right at the point of care. And then the last use is one that I think we forget about, but the use in medical education and training. So many of us have been on e-learning systems, which is kind of the one that you think about. But what about simulated clinical scenarios, artificial intelligence? There's lots of really neat and innovative things happening now on the clinical side with simulations and AI. And I know that's something that Dean Urbanowski is interested in too. And there's been some other Illuminate speakers speaking to that. So. In terms of benefits, I pulled this quote from the article and really sort of pointing to the fact that it can help make more rapid decisions, with lower error rates, increase the quality of data management and accessibility, improving practice efficiency and knowledge. And then the flip side on the patient care side, so a positive effect on patient care outcomes, reduction in adverse events, and a hospital length of stay. So there's more research coming out now speaking to the change in clinical outcomes. And those are the things that we really need to see in terms of advocacy for different types of services to really show that the clinical care that we provide has improves outcomes. So these are the 5 benefits that he pulled out of the scoping review. We've kind of already talked about most of them. Important to think about things like accuracy, not just from a documentation perspective, being able to read clinical notes, but improved accuracy in terms of things like diagnosis. Because you have all this information from digital systems supporting your clinical decision making, you can be more accurate potentially in your diagnosis and more accurate in the type of treatment program that you might decide for your client. Increased efficiency, there's often some debate about this one, particularly when you first adopt a clinical system. Many people complain that it takes them more time to do their work, and there certainly is evidence to support that, and that there's a need for changes to happen over time. I would argue a little bit that health professionals who don't have a good foundation of digital health literacy struggle way more in those early years than people who have a strong foundation. And then, of course, productivity. It may allow you to see more patients. It may allow you to decrease the wait list. It may allow you to just improve access to the treatment that you provide. So a really broad range of uses and benefits with mHealth. So now that you've had a little bit of a foundation, I'm going to talk now about the actual apps themselves and talk to you first about sort of how I sourced them and some of the criteria about why I chose them. So I used 3 sources. Physiopedia is the first one. If you're not familiar with it, I kind of call it the Wikipedia for physiotherapists. It's an open source or an open website. It's actually a UK-based charity, and they have lots of wonderful resources for physiotherapy and other rehab services. And majority of it is fairly evidence-based. They do have a mobile application section. If you've never gone to it, I would highly recommend you visit it. It's laid out in different sections. So I used leveraged material from their site. Practical Apps is another great website to visit. It's managed by the Ontario Telemedicine Network. And the focus of this website is to actually support healthcare professionals in recommending high quality apps to their patients. So it's a really good resource if you're interested in referring patients to apps, or you have patients asking you about applications. It's a great resource. And then I went to the Canadian Physiotherapy Association website, so our professional advocacy body. They don't have a digital health section per se, but if you search through their Shop Talk blogs, there are little bits and pieces about medical applications and health applications, so I searched in there. I chose the 5 applications based on whether they were developed or available in Canada. Obviously, I wanted you to be able to potentially use the app if you so chose. I considered the benefits of mhealth, so I tried to make sure that those benefits that were listed were sort of available within the apps as I chose them. I also considered scope of practice, so the different types of things that we do as rehab professionals, and making sure that I considered that, so not just looking at the physical body, but also looking at the mental and cognitive side of things. I wanted to choose applications where there was peer-reviewed literature to support their use. As I mentioned earlier, there's not a lot of RCTs, so taking that with a grain of salt, but making sure that those were the ones that I was sort of paying more attention to. And these are the 5 apps that we're going to talk about today. Some of you may be using or be familiar with some of them. So there's Functional Vitals, the Simpleset Physio exercise prescription app, Dr. Goniometer, Mobile OMT, and Headspace. So what I'm going to do next is talk about each app individually and talk about some of the features and functions, talk a little bit about privacy and the sort of user interface, show you some pictures of the app, and talk a little bit about some clinical application. I have a lot of information on some of the slides because I thought it might be used sort of as a resource after. So I may not talk to everything on the slides, but at least hit the important points. So Functional Vitals was actually developed by a Canadian physiotherapist, and she developed it in a hashtag Hacking Health challenge. And if you're not familiar with this group, it's an organization, Hacking Health, that's actually worldwide. And they run events where you actually get to develop an app with a team. You bring a team to one of their events, and usually it's a mix of clinical and technical people. And you build an app during the 2 or 3 day event, and there's mentors that come around and help you. And then at the end of the event, you actually have to pitch your app, and there's quite a big process to the pitching. There's like matching t-shirts and music and all sorts of fun things, and you actually have the opportunity that your app may get chosen by a publisher, and you get to take it sort of on the business side of things. So it's a really interesting event. They often have one at the National eHealth Conference every year. So this app is to measure and assess mobility in seniors. So Wendy Lee worked with a very more geriatric population, and it provides age-matched comparisons to facilitate improving performance in activities and participation. So it compares the normative values are from published functional mobility tests, and the app guides the physio through the validated functional screening tests, and it captures sort of real-time data right within the app and then gives you a display of the results. And you can actually print out an age-matched comparison, kind of like a report card, and I'll show you what that looks like. These are the tests included in the app, so fairly standard sort of mobility and functional performance tests, along with being able to collect some data on the clinical frailty scale outcome measures, which is evidence-based instrument to support measuring mortality and morbidity in an aging population. And so you can actually de-identify the data within the app, and you can trend it. So if I had 100 patients, I could look at all my patients over the age of 75 and see, are they all high risk of falls? Maybe I want to run a fall prevention program for that particular age group. So there are some neat data things that you can do. The challenge with this app is that there isn't a unique username and password needed for the app. There could be one on your phone, but all the data is stored in the phone, so there is a bit of a data risk. It captures name, gender, and age, so there is some personal health information in there. So I've provided a little bit of information here. This is just an iPhone app. It does cost $1.39 Canadian. You can use it on a few different devices. It is quite user-friendly, but it's a very simple-looking app. It has maybe a little bit of risk around data privacy. And it had 1 rating on the App Store, which I thought was kind of funny. Do not trust the ratings on App Store or Google Play. So this is what it looks like. It might be a little bit hard to see. The first screen there just kind of shows that you can select the different tests. So you just simply click on them, and you can see there's a bit of patient information at the top, their name and age. The second picture there shows the single leg stance. So it allows you to do 3 different tests, and it takes the average score, and it's as simple as like pushing the start button when you're ready to do the test. At the bottom, I don't know if you can see very well, but here it says comments. So you can actually click the button and add some comments, like maybe they weren't feeling well that day. And then you can actually graph the results as well if you want to. The third picture there shows the trending that you can do. So this is a combination of the single leg stance and the gait speed test for a particular patient. And it puts it on this quadrant, and it's hard to see, but doing the comparison, there's a little green dot here saying that they're sort of a high risk of potentially falling. They're unsteady. And then this is the report card. So it shows all the tests that were completed. The purple sort of long bar is the result for the patient. And then the green horizontal strip is the age match comparison. So you can kind of look from the very first test there, the chair stand, that they're a little bit below average. You know, the up and go, they're sort of more within the average. So it's a really quick and easy measure to look and see where they fit across those functional screening tests. And of course, you can print that out. You could give it to the patient if you chose. You could store it in a paper chart. Or you could, there's no interface with this app, so you would have to like scan it into your digital health record, which is a bit unfortunate, but that's the way it goes. So that's functional vitals. So Simpleset physiotherapy exercise prescription. I know there are physiotherapists in Manitoba using this particular app. It was designed by 4 physios in Saskatoon, and it has over 1,000 different exercises and a huge spectrum of clinical conditions. You can search by anatomical area, by exercise type. What I really liked about this is it has pictures and videos of the exercises, but they have culturally and ethnically diverse modeling in their app, which I think is really wonderful. So there's a different mix in there, which is really nice to see. And then just, it has, like I said, a broad scope of different types of exercise. If there's an exercise in there that you want that's not there, you can actually upload your own content by picture or video. So you could actually take pictures and videos of your patient doing the exercises, say, and upload them to the site. It has a really nice drag and drop user interface. It's quite modern looking and very easy to use. And then you send the information electronically to the patient. So there's a unique username and password that your patient has to sign up for. And then they just when they get the exercise, they just click a link and it takes them to their private space. I love that health science students can use this app for free because it does cost money. And you can use it for free until you graduate, which I think has really interesting implications from an academic institution perspective. As I mentioned, the patient has a username and password, and all the information inside the application is encrypted with really high levels of encryption. So there's very little risk in terms of breaches in privacy. And what's really great about this app too is it interfaces with Practice Perfect and Jane, and those are 2 common electronic medical records used by physios and actually here in Manitoba. And so it has an interface, so when you put in your demographic information into your EMR, and then you open up the application from within the EMR, it transfers that demographic data, which is great, so you don't have to double entry. Once you've put together the exercise program, it actually transfers them to the digital chart. So you have a record of the different exercises that you've provided to this patient, and it actually also tells you when you've sent the exercises to the patient as well, which is really nice. So this one has more, you can use it on many different devices and different platforms. It's $15 unless you're a health student, when it's free. It's very user-friendly, it has good data encryption, and there is the ability to export data. And the exporting part is more about sending it to your patient, but there are reports and things that you can run. You could actually run a report that, how many times did I prescribe this particular exercise? There's lots of different reporting that you can do. So this is what it looks like. the numbers kind of walk you through. So number 1 is I'm searching for, it's hard to see, but it says squat in that search field, so I want to find a squat. Then the app will provide me all the different types of squat that are within the system. And then I can just, with my finger, click on one and drag it over into that other pane and reorder the different exercises if I want to, just by clicking and dragging. And then each exercise comes with canned instructions and canned a number of reps and sets, but it's very easy to modify. So that number 3, you can actually go in there, and it's kind of like using Microsoft Word. It has all the different editing features, so you can make any changes. And then number 4 is what it looks like when it's stored in the digital chart, and what it looks like kind of when it goes to the patient. So they get a little list of those exercises. They can click on each exercise, and it opens up either the photo or the video, depending on what you've chosen for that particular exercise program. So really sleek, really intuitive and easy to use. So next I'm going to talk about Dr. Goniometer. There are lots of different Goniometer apps out there, and I'll tell you why I chose this one, because it was developed in Italy. It's not Canadian, but there's a reason why, and simply because it has some really good evidence behind reliability and validity, comparing it to manual measurement and e-inclinometers, and I've given some of the articles there, and I have a reference list at the end if anyone's interested. But it has some really good research behind it. It actually measures joint range of motion using your iPhone camera, and it used 3 constructs that I'm not going to pretend to understand and explain. But these are the different types of what it uses to create sort of this 3-dimensional image and a measurement of the range of motion. Basically, you align these markers on the screen to the joint that you're planning to measure, and kind of based around the same positioning that you would do for manual goniometric measurement. And it compares things to normalized evidence-based values, and I know there's always debate around what are the normalized values for range of motion. Off the top of my head, I can't remember whose normative values they use, but it is in the app. The data is, one of the challenges is the data is all stored on the device, so it doesn't go up into a cloud or anything like that, but you can back up the data to another source and have it protected on another device. You can only do that within the same local network. So if I'm at the clinic on a certain network, I can't back it up to somebody else who's outside that network. So there is some protection around privacy from that perspective. And it has a really interesting application for what they're calling joint selfies. So from a tele-rehab perspective, if you have a patient who you're seeing maybe through telehealth, and they could potentially use the app, maybe they're post-knee replacement, they live in rural Manitoba, not around where there's care, and you can actually have them take a joint selfie of their range of motion, and then it could be sent digitally to the therapist who's doing the care. So there's some really interesting applications and innovative applications for this particular app. And they're doing some updates to the app. They may already be done, I'm not sure, I'd have to look, but they want to enable the app to measure multiple joints at once. So they're thinking about postural measurement and looking at different populations, like maybe a neurological population where they might need to, the measurement of multiple joints is maybe more important for decision making. So it's only available on iOS 7, so relatively new. It is $17. There's no free trial. It is available in a few different languages, which is interesting if that's important. And you can use it on a bunch of different devices. So it hasn't been rated in Canada, but you can access the app in Canada. So I'd be really interested to hear about physios or different types of rehab professionals using this device, this app, and to see what they think. So just to show you a little bit about what it looks like, you sort of pick the joint, and then you pick the type of range of motion that you want to measure, and then it will open up the screen that you commonly see on your phone. Do you want to shoot a photo or a video? You can set different tilts. So for example, if your patient has a postural condition where they're not in an upright position, you can set sort of that start tilt to make sure that you're getting a proper measurement. And then this is kind of what it looks like. So you use your finger to kind of drag those red points and position them where you would sort of use your manual goniometric, your bony landmarks and things like that. And then it will actually, at the bottom there, it says 79.4. It will calculate the range of motion for you. So I thought this one had some really interesting applications, and as I mentioned, some good evidence behind it. So moving on to the last two, this is mobile OMT, and it's actually a suite of 3 apps. And it was developed in San Antonio, Texas by Clinically Relevant Technologies, and they develop a lot of different medical apps. They have lots of really good ones. This suite is a spine and upper extremity and a lower extremity. You can actually purchase the apps individually or as the suite of 3. And the fundamental principle at Clinically Relevant is that their content is backed and informed by high-quality, peer-reviewed research. So you have some, when you use their tools, there's that understanding that there is evidence behind them. It has both manual and manipulative therapy content, and their goal is to support students and practicing clinicians and educators who are teaching healthcare professional students. It gives really simple step-by-step instructions and high-resolution images and video, along with audio recordings for more than 140 different techniques. So there's lots of scope in the app. The pictures also show multiple positions. So they'll show, maybe how the therapist is standing from the back, and then how the therapist is from the front, so you can maybe see hand position. It also is accompanied by a list of articles relevant to that particular test. So you kind of scroll down to the bottom of the app, and there's actually often hyperlinks to any of the articles that are openly available. It also provides a list of conditions that might be applicable for the use of that particular test, and some common list of indications and common conditions for each technique. It also creates instructions on, or has instructions on, physio positioning and patient positioning. So it's very robust. They do have a volume purchase program. I thought this was interesting for accredited academic institutions because it is more expensive, but there is a volume purchase program if an academic institution was interested in using the app as part of their learning process. Interesting that the app is full of literature, and there's no literature on how this app actually supports and improves learners or clinicians in their practice, which I thought was fascinating. And there's definitely a real opportunity, I think, to do some research on this. It would be really interesting. So it's available on iOS and Android. They're $40 each, or you can buy the suite for $70. It does have a Mac capabilities, which is rare for a lot of apps. So you can actually use the full suite if you're a Mac user, which is a bonus for a lot of people who prefer that platform. It's very user-friendly, and it has some good reviews. So the 4.3, 4.9, 4.4 are for the spine, upper extremity, and lower extremity. So this is kind of what it looks like. So again, I've sort of picked the shoulder at the very top in the green. It says shoulder. And then I'm looking at shoulder techniques. And then there's a whole list of different types of techniques. And I've clicked on Faber posterior anterior mobilization. And it's going to give me the indications, the patient and the clinician position. It's going to give me a few different pictures. I've just shown one here. And then on the right-hand side, I've shown an example where there's actually a video of the procedure. And there's audio with all of the videos as well. So they talk you through all the different steps. And then, as I mentioned, when you scroll down, it gives sort of a summary of why you might choose that intervention, the different types of conditions. So it's talking about adhesive capsulitis there. And then you can see the little blue hyperlinks. It's linked to some of the literature relevant to that particular test. So there's lots of information in this app. I'm going to assume that they struggle with keeping up to date on all the research. If you look at the articles down below, like one's from 1984, so it doesn't mean that it's not a good evidence, but when we're looking for potentially things that are more up to date, it varies a lot within the app. But at least there's information there. And the last app I want to talk about is called Headspace. And it's actually a meditation and mindfulness app. Some of you may be familiar with it. It was developed by Andy Pettycombe, who is interestingly a sports scientist who then became a Buddhist monk, and Rich Pearson, who is a stressed out executive. And they worked together to de-stress Rich using this particular practice, and they called it mindfulness. And it's everywhere now, everywhere. It's based on the evidence-based practice of mindfulness, and it's a well-established practice to reduce stress and anxiety in both adults and youth population and kids. This app is ginormous. So it's in 190 countries with over 1 million users. All the operational and the data storage is in the States, so that's something to consider with the use of the app, and I'll talk about that a little bit more as we go along. It has visual and audio-based guided meditation, and it targets a whole bunch of different things: stress, anxiety, performance, sleep, focus, and it uses mindfulness practice. And there's some really good literature and new literature that's come out specifically using this app, and it's shown that it's reduced stress by 14% in youth, increased compassion by 23%, and that was also, I believe, in a youth population, and improves focus by 14%. And I believe the first two were RCTs, if I recall correctly. So there is some good evidence behind this app, and there's more evidence coming out. It's got lots of privacy protection, so you need to have a user account. You create an account, and that enables you to sort of track what you're doing within the app, and also some of the user preferences around how you want to shape the app. Really interestingly, too, if you're a fan of Google Assistant or Amazon Alexa and you have a digital house and you like that verbal cue, it connects to your Alexa and your Google Assistant. So you can just give it a verbal cue and it will start your mindfulness practice for you, which I thought was really neat. It has a cartoon-like interface. It's quite simple, but it's really engaging, even for adults. You sort of look at it and you think, oh, it's kind of like for kids, but if you use the app, it actually is part of the value of the app is how that interface looks and feels. So you can use the app for free to start, and it has 10 guided meditations that are free. And there's sort of a variety of different types of meditations. Otherwise, you have to subscribe. And so you can subscribe monthly or you can subscribe annually, and then you get like hundreds and hundreds of different types of guided meditations. And also, if you subscribe, you get access to their online community. So remember, we talked about those tools connected to the app and that they get 4 times more downloads. Headspace has a ton of social networking connected to it, tons of forums and communities of support group kind of groups. So that's where the privacy risk is potentially with this, because all of that data is housed in the States. So just in terms of accessibility to the data, there's not a lot of personal health information really in the app, but if you're on a blog and a forum and sharing a lot of personal health information, there could be that risk there. The app itself is only available in English, but the forum piece and the community side of thing is in multiple languages, like maybe over 20 different languages are within that social networking side of things. You can use it on a variety of platforms. Those are the costs there. So it's $13 a month, which could be expensive for some people, or $8 a month if you subscribe annually. You can use it on your smartphone, or you can use it on a computer or laptop. And it does get good reviews. There's an asterisk there. I think I spoke to it already around the English only. Again, there's multiple languages only in the social networking piece, and the data privacy was around the servers being in the US. So just a few screenshots from Google Play and from their website that are publicly available. So it kind of shows on the left-hand side there that there's sort of hundreds of different types of meditations. So sort of if we look at this one here, I know it's hard to read, but the categories say featured, meditation essentials. If you want to focus on stress or you want to focus on personal growth, you can kind of click on the category and then it gives you all the different variety of things that you can do. It does have a separate platform for kids. So if you subscribe as an under 18, you have a separate platform, which I think is really interesting. And they have their visuals are a little bit more fun. And instead of saying, I want to de-stress, the little owl here says, I want to cool off, just a little bit of different terminology that might be more appealing to a younger group. The middle picture here is I've selected one of these things, and so it brings up that this is I want to let go of stress, and you literally just hit play. This is a play button. You plug in your headphones or you listen on your device, and it walks you through the practice, and it tells you how long it takes. So that one's it says 10 to 20 minutes. You can't read it, but it's a 10 to 20 minute mindfulness practice. The next one says perform at your best, so keep running. So this is actually, they have some partnerships. So this one is a partnership with Nike, and it's Coach Chris Bennett. Didn't mean anything to me, but if you know about Nike, apparently he's a running guru and a coaching guru. And so he participates in this particular mindfulness practice that is meant to use when you're running. So you're doing your exercise, you're running, and it's giving you this sort of motivational mindfulness little session through your earbuds as you're running and motivating you to run further, run faster, whatever your goal is. I also wanted to show that in terms of behavior modification, this is all about, the section at the bottom is about mindful eating. So that's, if we're talking about potential behavior modification and helping with prevention and health and wellness, there are some really good meditations and mindfulness practices you can do here around not just your physical state, but managing perhaps food is an issue for a patient, and they can run through some of these different practices. And then I just put this up here because this is from their health apps section. It's got a variety of different things, but at the bottom here, if you can read them, this one says coping with cancer and pain management. So chronic pain caseload or some of your patients who may be struggling more with pain, you can actually leverage some of these mindfulness practices potentially to help your patient with reducing some of the issues they may have. Okay, so just before I wrap things up, I wanted to talk about the MARS tool. So it's a relatively new tool for assessing quality in health apps. It's from 2018. It's a really simple and objective tool for assessing quality and can also be used as a secondary use if you're developing an app to make sure that you've considered a lot of these different multi-dimensional components. And it looks at sort of quality indicators. And these are sort of the list of them there. So, is basic things like, is it fun? Is it easy to use? Is it easy to learn? Does it look nice? Is there information in it of high quality? Would I recommend it? How often would I use it? And things about how it impacts you as a user. Is it changing your behavior? Is it impacting your knowledge or attitudes? Is it giving you some intention to change behavior? And it's all measured on just 23 questions using a 5-point Likert scale, so relatively simple. And what they haven't done yet is determined when you get a score, what's low, what's medium, what's high. They haven't quite got there yet, but they just haven't published the work yet. But I took a really good look at this tool, and I found I think it'd be a really valuable tool to use, and I'm really interested to learn more about where the research goes with the particular tool. From a learning perspective, I thought this tool was important because if there's some discussion about health technology in the college here, there's always a conversation around what's good quality and teaching our students to understand that not everything they read is good quality. And so this is a really great tool to be able to measure that for them. So I wanted to end with just a little bit of a challenge here. How am I doing for time? Oh, I'm good, okay. This won't, just take a moment. So these are yes or no questions. It's not a test on what we talked about today, but maybe just a bit of reflection on what we've talked about. So clinicians are under more pressure to retain a high level of information. Yes or no? Yes. Ability to seek, find, comprehend, and critically appraise health information gathered via mhealth tools is critical. What do we think? There's nods? Not a resounding yes. I'm saying yes. mhealth has great potential to support rehab science professionals, improve the quality of life for patients, and manage their own health and wellness. What do you guys think? Comprehensive digital health literacy education is included in the course curriculum. I set myself up there. Development of digital health core competencies could support digital health literacy in learners and practicing clinicians. So, yay! If you take anything away from today, that's what I'd love you to take away. So there's so much innovation happening in this space. There's a new app coming out, constantly, all the time. So we need to use them because there's definitely evidence behind supporting that they improve patient outcomes. I didn't talk a lot about the perspective of using it on ourselves as therapists to sort of protect our own health and work-life balance, but that's certainly another component, particularly when you're looking at that Headspace app. That is the app that I started using after I wrote my paper, and I've actually found it incredibly valuable. I won't go into lots of detail, but if you want to ask me about it, feel free to ask me about it. It really does what it says it does. So again, today we talked about sort of the difference between eHealth and mhealth, some background on mhealth. I introduced you to those 5 apps, and we talked just briefly about how to evaluate the quality of applications. And that's me. Thank you very much.
I will now ask the audience if they have any questions, and I'll run this microphone over to you. Don't be shy. So, okay, I have a question.
Yeah.
Now all of a sudden I can't remember, the Mars.
Yeah.
The Mars.
Yeah.
Did you actually apply that to the 5 apps that you chose?
No, I didn't.
Just curious how they would rate.
Yeah.
That's
No,
weird.
that's a great idea. The paper was actually written and submitted before the Mars came out. But that would be, a good follow-up, I guess, to the paper to actually do that. Yeah, for sure.
So how long do you think overall that this is going to take us to do? I mean, you're proposing that you're going to be finished the initial stages and starting, sort of down that road or whatever, kind of summer, fall kind of thing, and then more and more and more. How long do you think it'll take for the uptake?
Uptake of like digital health in general?
Yeah,
or?
and for a group like physical therapists, and
Yeah.
maybe my OT counterparts might be a little further along
Yeah.
in accepting that
Yeah.
because of their experience with assistive
Yeah.
technology and that sort of thing.
Sure.
But just this idea that this is here and we should
Yeah.
be exploiting it.
Are you okay if I share some of my data from my study?
Absolutely.
Okay,
yeah.
so I did prepare slightly for this question. So this shows the 5 different types of systems that most physios are using if they're using a system. So billing, scheduling, a charting system, exercise, prescription, and outcome measures. Knowing that some of them might be in the same tool, but some might be standalone tools. So I've broken it out actually by public practice is the blue, and then private practice is red, and then green is the total. So I was actually pleasantly surprised to see that the adoption rates are pretty high in a lot of categories. Billing scheduling makes sense because a lot of us have been using those tools for a long time. I was surprised that the charting, the e-documentation, was over 50%. Because a lot of the people that I talk to do the billing and scheduling, but they don't do the documentation side of things. So I was pleasantly surprised to see that. So I think in terms of timing, like at least we've got fairly good adoption rates already. So it's how do we get the remainders onto the digital systems, and how do we encourage that? A lot of that can happen from encouraging it from the learner level, right? So what they've shown with the competencies, digital health competencies have been developed for medicine, nursing, pharmacy. And they've been around for quite some time, like since between around 2013 or 2011 to 2013, they were developed. They're not well integrated into the education programs, which is a challenge. And so if you're not learning it at that learner level, there's less motivation, I think, to maybe pick it up in practice. And how we got a lot of physicians to do it was we gave them money, a funding program to help adopt electronic medical records. So looking at sort of those opportunities, I think having the foundation of the digital health competencies and integrating some of that into the learner piece is a really good way to promote adoption out in the community. If you learn to do it on an application or on a digital system, or it's a component of how you're learning to do things, then you're more likely to use it out in practice. And what's happening now is physios are graduating into technology-enabled practices. And we're not always allowed to use the systems or given access. But if we were able to advocate that we should be using those systems, we've learned about them as part of our program, we have the competencies, I really believe that competency at the learner level is important, because what we're seeing with a lot of the physicians that picked up after they were practicing is it takes them a long time to get good at using the system and optimize use and really leverage the data. Whereas if we had those competencies built into the learner level and you start using them right away and it's a part of your practice, then it's easier to get people to use the systems better, more quickly. Yeah. In terms of timelines, I don't know, when do you want to start putting digital health competencies into your program here?
I guess as soon as you create them.
Yeah.
Let me
Fair
just
enough, fair
run
enough.
this down here.
Thanks, Katie. Absolutely fascinating.
Oh, good.
I'm looking at the data there on the screen for outcome measures.
Yes.
And that's considerably lower than the others. I mean,
Yes.
I don't even have to run stats to know it's different.
Yeah.
That concerns me.
Yes.
And it concerns me for two reasons. One, outcome measures really are the foundation of research, right?
Sure.
And in order to demonstrate effectiveness and that you're of value in the system and all the rest of it, you need that data.
Absolutely.
The other part of it that really concerns me the most is this going to further fragment the system? Because we know that in the public system, there are many, and you have shown us that, many different sort of flavors of eHealth.
Yes.
And suddenly we have another flavor of eHealth here, which I think is the way of the future, but obviously you do too, but not everybody would agree with us. It's that fragmentation that concerns me, because I think our healthcare system is, it's at the brink right now. It needs to get a grip.
Yeah.
And if it doesn't get a grip electronically, as taxpayers, we're all screwed.
Yeah, it's certainly, there was a huge push for adoption for a lot of years, and adoption of approved systems, but there was lots of choice. And interestingly, from the physician perspective, when we looked at moving to one system, the pushback from clinicians was huge. Like, we heard loud and clear, we don't want to be told what system we should use, we want to be able to pick the system. So that's created actually some of the challenges around all the different types of systems. So it's our job from, and I think we'll see this more now that eHealth has moved into digital health and shared health, that the interoperability piece, we're starting to connect the systems. And what's happening now is it's not always the systems connecting, but if you're familiar with eChart Manitoba, it's our provincial electronic health record. And it's basically like a compendium of information from a bunch of different source systems. So it has diagnostic imaging and lab results and immunizations, and it has some hospital information as well. And it basically takes the information from other databases and parks them in one place based on a patient FIN. And it's provincially run and all that kind of stuff. Physios have really low access to that system, and it could be really valuable for us. Instead of having to contact a diagnostic imaging site to get a report, I could just look in eChart and have that information at my fingertips. So it's not always about using the same system, but it's making sure that we have access to all the different information. And tools like eChart can be a good one because it's a compendium. And there's also lots of talk about giving patients access to their information, right? And then they share it with the providers that are important to their care. So I agree with you. We've created a monster, but there is a lot of work and understanding that interoperability has to happen and that it's critical. The first part that you talked about with outcome measures, I feel pretty confident that we're doing a lot of paper outcome measures. So that part is good. But from an electronic perspective, it's challenging because there aren't really good systems out there. There was a big national push from CPA to have people use photo, which is like an electronic system. And I had lots of conversations with them about this. I think part of why it was a challenge to get the implementations going was because we don't have this foundation of digital health literacy. It's a standalone tool, so we have to stop from our clinical workflow, log into a system, put in all the data. Like, our patients aren't entering data in there, we're entering the data from them. So there's it doesn't align with clinical workflow. And the evidence really shows if it doesn't align with clinical workflow, they're not going to use it. And it shows. It definitely shows. If there were more systems, I think we might see that adoption come up. If they were integrated into, say, an electronic medical record, kind of like that Simpleset was integrated with Jane and Practice Perfect. If we saw that happening, maybe they're completing the questions on a tablet, right? And it's going right into the system. People are going to use that. So the good news is that I'm sure there's paper outcome measures. I know as a therapist, we're doing outcome measures all the time. But even the paper ones are hard because again, like how do you integrate it into everything that you do? So there's a real opportunity for mHealth to make that more seamless for us, yeah, and leverage the data. When we look at advocacy and some of the health system changes, we don't have good data to support that what we do works, right? We're not on digital systems. We don't have this big data that we can, throw reports and say, these are the outcomes that we get. And so in terms of advocacy, that's also a big part of this, right? Is the more we adopt and the better we use the systems, the more we have data to support what we do. And that informs policy. Yeah.
Thank you. And on that note, I'm going to end our session today. Thank you all for attending, and thank you for the great presentation.
Thank you.